9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. Good evening. Well, I'm probably on. This is Dr. Gerald Thompson. We started a little late this evening, and this is Your Health Matters. And it's certainly a pleasure once again to be on the program, 8 p.m. At least right now it's 8:10 p.m. on a Wednesday evening, and talking to you about health and the environment and things of that nature. As usual, the program usually flows with me doing a bit of a monologue, but anytime you could always interrupt me and call a question, ask a question of your choice on the topic of the day or on any other subject, and we can try and explore it. I want to start off by expressing my condolences to the family of Rasai. He was a shopkeeper on Tokyo. He called in on this program and on other programs quite frequently, expressing himself vehemently. And I know he was a good friend of my father's and used to always talk about my father. And Rasai, normally we don't talk about why people pass away. But he passed away, and he passed away due to prostate cancer. And that's really unfortunate, and I want to extend my condolences. And so I think his funeral will come sometime maybe after Carnival, but I thought it appropriate to say something about him and also talk a little back again about prostate cancer. And Rasai lived in New Montrose, just a little above where I currently live. And, he was a good man. He was a good man. And certainly he'd be an individual who'd be missed. May his soul rest in peace. Now, let's talk a little bit, though, about prostate cancer and what's been happening over recent years. For sure, there's been some recent advancement in prostate cancer research. And we are now, because of the importance of prostate cancer, we're seeing new diagnostic tools, new methods of detecting prostate cancer. 2, improved treatments. And 3, a better understanding of the disease itself. How it progresses, how does it behave, how does a cancer behave? Now we've been seeing that in terms of tests, in the past, we used to rely a lot, 15, 20 years ago, on inserting a finger that had a glove on the hand, inserting a finger up a person's back passage and feeling the prostate to see if it was bumpy, if it was hard, to feel and see if it depicted any signs of some sort of cancer. Now, there are other diseases that affect the prostate. Sometimes there's an infection called prostatitis. And if you do a digital rectal examination, a DRE, what happens when you touch the prostate, it feels soft and tenderish. Matter of fact, when you press on it, the person usually experiences a lot of pain. Ooh, it's painful. Then there's another condition in the prostate called benign enlargement, benign prostatic hypertrophy, when we insert a finger into the back and feel the prostate, the prostate feels not like a Beckwith plum, but it starts to feel more like an egg, the size of an egg, or sometimes it's the size of a wrong mango, a big one. Yes, a wrong mango. And we know that isn't right. But when the prostate feels bumpy, it's not tender, and it can be a little bigger, but it just feels hard, that's not a good sign. That sounds as if something is swelling up and infiltrating the tissue of the prostate and make it seem different, funny. And we usually pick it up as cancer. Well, sometime after that, around in the late 90s, we found out we could do some blood tests, right? Called PSA, prostate specific antigen, because the prostate tissue produces some special secretions. And when there's a cancer, more of these substances are produced. And therefore, we can do a blood test to detect the presence of a cancer. And especially for some people who didn't want the digital rectal examination, putting a finger up the back passage and feeling it, we could then start doing the blood test first. And if the blood test was normal, then we can, avoid having to do the digital rectal examination. But if the blood test was normal, it then would be good to tell the patient, look, let's get the digital rectal examination out of the way. Let's feel it, just to feel it and see exactly what's going on and how it feels and so. Well, the problem sometimes is that blood tests are not 100%. They don't pick up the elevated substances, the prostate-specific antigen, the PSA, early enough, or that it may not rise sufficiently to give you an alarmingly high test. And so by the time we wheel and come again and check it later, we then see a high blood test. And that's when we start action, when action could have taken place 3 months, 6 months, 9 months before. You understand what I'm saying? Early detection is important. A stitch in time can save 9. Now, today, early detection, we are now seeing new biomarkers. We could test for other things, other substances that are released in early prostate cancer. They call biomarkers, certain other substances released by the cancer. And we can test for those, right? And then there's some new treatments, in addition, the new drug therapies, including some inhibitors, right? That target the area of the prostate that is causing the cancer, are showing great promise and really high level of success. Now, so researchers are exploring new methods of early detection. There's even now a urine test, instead of a blood test, a urine-based test, right? That is allowing us to pick up the presence of prostate cancer and identify prostate cancer at its earliest stage, And then in terms of treatment now, there's some new hormone therapies, new hormone therapies that are really doing a great job in really picking up and getting rid of this cancer. What it does, there's a hormone that's produced by the male man, the men, not in women. Women could be called testosterone. And these new drugs can block the effect of testosterone, because sometimes the prostate cancer is using testosterone to grow and gain strength, right? And we are now having a much better understanding of this disease. Now, what research has been done all over the world. And I've said to you already that in almost all countries, prostate cancer seems to be on the rise. But in terms of an ethnic group, in terms of a racial grouping, no doubt that prostate cancer among Black men has certainly been high and has been continued on the rise. You know, it continues to be on the rise. And we really have to do more about that. Matter of fact, there's been a rise in prostate cancer and oral cancer in men. There's been a rise in prostate cancer and cancer of the mouth in men. Prostate cancer is now nearly on par with lung cancer as the most common cancer in men. Long ago, in Europe, Canada, America, where men used to work in mines, in coal mines and all that kind of thing, and men used to, the effect of smoking, and so among, as well as in major cities, the air pollution is unbelievable. Air pollution in Los Angeles and New York and London and big cities is unbelievable. The amount of chemical particles in the air that when you're breathing, it's not like Rose Hall. Come out. It's not like Rose Hall. You go up there and you breathe in and you're getting fresh air. Not like Park Hill, you know, fresh air. It isn't. The air may seem fresh, but boy, it has a whole set of dust particles, chemicals, all kind of this, that, and the other. Really, not just from factories, but from cars, tires, and all that kind of stuff. And then people smoke cigarettes in particular. And what's happened is that lung cancer used to be the biggest cancer out. Breast cancer, the biggest cancer in women. But lung cancer in both men and women was more than breast cancer. But now prostate cancer has risen to be on par with lung cancer. Imagine that. Prostate cancer is the most common cancer in St. Vincent because we don't have a lot of lung cancer. Lung cancer is for Europe and so forth. But for us, the biggest form of cancer today, men and women, is prostate cancer. Last 2 years, prostate cancer overtook breast cancer in St. Vincent as the leading cause of cancer. And prostate cancer is now on par with lung cancer in the rest of the world, in highly polluted countries, as a cause of cancer. That's big. That's crazy. But in addition, there is a virus, there's a germ. It's called human papilloma virus, HPV. And this HPV is causing cancer of the mouth. It's also the cancer that causes cervical cancer, cancer at the tip of the womb. And probably because of, I've got to say it. Don't be upset with me. Because of oral sex, right? Probably because of oral sex, that the spread of this HPV virus, there are many, many, many types of them, but a few of them number 16, number 32, and what? They are the ones that cause cancer. In other words, number 33, number 34 don't really cause prostate cancer, but 16 and 32, boy, they're big as the cause of cervical cancer. But in addition, there are a number of them that cause cancer of the mouth, cancer of the mouth, cancer of the back of the throat. And once again, it is said that is partly related to the now common practice of oral sex, both types, Now, I've never said to scare anybody, right? Kamal, I didn't say that. You wouldn't get scared by that, did you? Right? Now, lung cancer is the second most prevalent cancer worldwide and the most commonly diagnosed in men, right? 15.4% of all cancers. But the incidence of prostate cancer is almost as high. Now, 15.1% of all male cancers are prostate cancer. That's big. 15.4 is lung cancer, 15.1, and it's expected that within the next 5 years, prostate cancer will overtake lung cancer. The number of lung cancer cases and related deaths are largely decreasing as more people quit smoking and the early detection of lung cancer continues. At least where these resources exist to do like CAT scans and MRIs to pick up the early cancers, there's been successful detection of lung cancer, according to the World Health Organization. And certainly tobacco smoking has been continually on a decline, although they're seeing it a little uptick among the youth. Now, let me say, the incidence of prostate cancer, however, is rising significantly. And whether in all countries, in a report out of Australia, right, it highlighted in the opinion piece published that there's been a rise, and listen to this, a rise of 34% in 1 year in Australia. But around the world, it's been going from 15 to 30%. And the number of men diagnosed with prostate cancer in Australia overtook breast cancer as well as the most common form of cancer in that country. Largely because women are doing the self-breast examination, they're checking themselves, they go to doctor regularly, they love go to doctor. Women love going to doctor. Men hate doctors, That's why come out, I keep looking across to you and so forth. I know you're busy on the, you got all sorts of issues. But furthermore, this is affecting younger men who are being diagnosed at more advanced stages of the disease, and the thing is, the myth that prostate cancer is a disease of old men, old man disease, is now changed, and that men will die with it, not from it. That was the thinking in the past. Men will die with it. Die from it. When I was a medical student, we did autopsies on patients. You would find some of them have a small prostate cancer. Let's take this call before we go to break. Hello, good morning. Good evening.
Dr. Thompson, good afternoon, Kamal.
My apologies for saying good morning. I felt I was on the morning program and so forth, Monday morning program, where I'm a little bit more combative. Tonight I'm calm and quiet. Yes, go ahead, brother.
Tell me something now.
Yeah.
Well, we know oral cancer, oral sex, man doing certain thing with the vagina and thing with the mouth. We know that unhealthy, yeah?
I'm not too. No, hold on, let me stop. Listen, let me stop. Let me stop you there. But okay, let me let you go on. You ask a question, let me answer. Go ahead.
Yes, and then a question I really want to ask you: if you think a man that oversex, whether he wife or girlfriend or what, could cause toxic cancer?
No.
A man that oversex, not ejaculating and thing and oversex and thing could cause.
No. As a matter of fact, ejaculating is a good thing. Men who don't tend to ejaculate a lot and so forth. There have been all kind of studies. There's no real difference between them. But if men who ejaculate are probably less stressed, less under pressure, a lot more relaxed and so forth, a lot more at ease in life. You know, I would say somebody who's not having sex, a male who's not having sex, would tend to be more frustrated and more upset at simple things and so. But oral sex is not necessarily unhealthy either. You know, clearly, you know, you need to wash and so forth beforehand. But that there are diseases from conventional penis to vaginal sex. You know, syphilis, gonorrhea, all those things are spread in that way. And that oral sex, yeah, you could pick up syphilis and gonorrhea that way too. You know what I mean? So there isn't any difference in the way in terms of unhealthiness if people bathe and if people are washed, if people are quite clean and so forth in that regard. You know what I mean? Let me just put it that way.
I'm Dr. What's the name again, boy? Anyhow, I know you're a doctor. Tell me something now.
Dr. Thompson.
No, we see on Instagram and laptop and this and that. We see a lot of ladies now having dog as pet. And some dog and them having sex with them themselves now.
I can't comment on that. We can put that one off. I'm not gonna. I don't know if that's true. I can't entertain that. That's not medical. I'm not sure.
Happening in the world, right? But let me just put it this way.
Yeah.
Like somebody having interference with an animal, whether a woman or a man, they think that could cause.
That's not good. That's not gonna produce prostate cancer or anything. But that's not good. That's sodomy. That's a whole set of buggery. No. I don't agree with that. Maybe let's stop there. You ask a question. You will start getting into some real corners there.
Yes. Well, let me just ask this last question.
Okay, all right.
Having clean sex,
huh?
Married, doing the Bible say.
Yes.
And you might do a partner. Well, oral and them kind of things. So you think that could lead to any disease? Anything like that? Yes.
Oral sex is not going to lead to any. Okay, you listen off that. Oral sex is not going to lead to any specific disease. It could lead to the same illnesses as what we consider conventional sex. That is penis to vaginal sex, right? And that penis to vaginal sex, over the years, you have seen warts, you've seen syphilis, you've seen viruses like herpes, you've seen other bacteria like gonorrhea, you've seen lice, you've seen other type of warts. Matter of fact, some big warts, you know, that can develop. I remember in the past I've had to cut off warts and so forth from men's penis and vaginas and all this kind of thing. But I can tell you that in terms of sexually transmitted diseases, they are predominantly from the standpoint of penis to vaginal sex. Oral sex, and I have to add anal sex, can certainly be the same way. And, persons may certainly have their preferences, but I want to encourage people to always be very careful and in whatever they're doing. And protection and so forth is the best strategy in this regard. I mean, that's what I have to say. I don't want to go into too much detail there. But let's take us a little break, and then we come back and I'll continue and we'll continue to open up the lines.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Now, I was on the point about prostate cancer being an old man's disease. Well, do you know, I'll take the example of Australia again. Thousands of men under the age of 59, let's say 60 is considered to be old, but thousands of men under the age of 59 have been diagnosed with prostate cancer every year. Let's say in 2023, there were 3,500 men under the age of 59 in a single year. And one of them will die roughly every 5 days. And often younger men get more aggressive cancer, the aggressive form of the prostate cancer, if I've mentioned that. This is not an isolated situation. And if you start going around the world, right, when they've checked out at least 112 countries, the leading cause of cancer death in 48 of those countries was prostate cancer. You know, this accounts for more than 1.4 million cases and over almost 400,000 deaths, you know, which is actually greater than the number of deaths from cervical cancer, cancer of the womb. Now, these numbers are expected to double in the next 15 years. By the year 2040, the number of prostate cancers is going to double. Kamal, you're a young man under 59, right? And I am not trying to scare you. I'm trying to alert you that this is something you need to pay some attention to, right? Now, the early detection of prostate cancer, as with other common cancers, virtually guarantees some successful treatment. Doesn't always, but when the resources do not exist, if you're in a place they don't have blood tests, they don't have ultrasound, they don't have, clearly you're in problems, you know? And this is a serious issue. And so today, more than 70% of men with low risk, non-aggressive cancers will be treated with slow, self-effective strategies. Let me say this again. Prostate cancer can have several characteristics. It can be a slow-growing, old man-like disease, or it can be a very aggressive, rapid, metastasizing. I use that word very carefully and talk about, it means spreading cancer, aggressive spreading cancer that kills individuals. And we have to really watch this very, very carefully. Now, I want to move on and say prostate cancer is a funny disease. The prostate cancer loves to spread to bone very quickly. But quickly means that in the old man type prostate cancer, the slow growing prostate cancer, it may take 8 years, 10 years to spread to the bone. You understand? But in the aggressive cancer, the cancer develops, you pick it up after 3 months and 6 months, it spread. It don't spread already. No. Now, some terminologies you have to understand with prostate cancer is you got to understand what's meant by a biopsy. Taking a biopsy of the prostate. You got to understand what is meant by chemotherapy. That's the kind of drugs and so we give to fight the cancer. You know about cryosurgery. There's what's called cold surgery, using freezing the area where the prostate is so that you could do surgery much better. That helps. Then you got to know about radiation, external radiation, you know? And you have to also know about really some of the type of tests that are needed. We, in the past, we have relied now on the standard blood tests. And then if any problems, we talk about surgery to remove the prostate. That's called a prostatectomy, removal of the prostate. If surgery is your best treatment option, your doctor will discuss this with you. In addition, there's radiation treatment, zapping it with some high blast x-ray, not the usual x-ray. You go to take an x-ray of your chest and an x-ray of your bones if your hand, to see if your hand break. I'm talking about some high intensity radiation that will zap the tumor, and they have to focus. They can't just set it at your head, at your toes, and all over the place. They have to focus specifically on your prostate, right? And these high energy x-rays and other types of radiation will kill the cancer and hopefully stop them from coming back. But then there's also medical treatment. And we talk of chemotherapy and hormonal treatment. Remember hormonal treatment, I mentioned to you a word, is treatment that blocks testosterone. Testosterone likes to give the prostate cancer food. It's like you know, we water plants and we give the plants fertilizer. Testosterone is like fertilizer to the prostate cancer. So you want to block that, and there are hormones that and therapy and things that will do that. And there are lots of clinical trials, but over the years it's been said that black men don't sign up for clinical trials, and that's something that we really have to look at and see. A couple number of questions. So one of the latest treatments of prostate cancer, right? I don't want to get into the terminology of it, but let me say there are some good treatments that unfortunately are not available in St. Vincent. These hormonal treatments are not available in St. Vincent, but I'm hoping that in the next 4 or 5 years, they will be, because things progress at that rate, you know? Now, we have a couple of questions. Is there? Somebody typing one, is there? Good night, gentlemen. I just joined the program. I have a question. What is the life expectancy of a person with prostate cancer that has spread to the bones? Well, that is a very interesting. I'm going to answer it. You know, let me go through what are the basic treatments for a person who can't afford? Well, this is good question. Good questions. Thank you very much. Let me go through some of the other questions I think that you may also want to ask. How long can a man with prostate cancer survive without treatment? Now, that is, how long can you live with localized, untreated prostate cancer, no treatment at all? Now, many men can live 10 years or more if the cancer is localized and slow growing. Slow growing. Remember I said there is a slow growing old man type cancer, and there is an aggressive, rapidly metastasizing cancer. Now, what are the signs that prostate cancer is getting worse? Right? Because if you have a slow growing prostate cancer and you say, well, I've got a slow growing one, what's a sign that it's getting worse? And then maybe look to pick up and speed up. Well, I'll answer that. Signs of and symptoms of an advanced prostate cancer would include accidentally leaking of urine, back pain, pain going to your back. You know, you had back pain. Bone pain, that's one part of the question. Difficulty getting an erection, called erectile dysfunction, of course. Feeling very tired, losing weight without trying. You know, it's not that you're out exercising, walking up and down the runway, E.T. Joshua Airport runway. You're losing weight by just sitting down. Weakness in your arms and legs. So how long does it take for prostate cancer to actually spread to your bones? A prostate cancer is a slow-growing cancer in most cases, 70% of cases, and it is confined to the prostate gland, right? Now, when it is confined to the prostate gland, it may require minimal or no treatment in some cases. It can take up to 8 years to spread from the prostate to other parts of the body, right? Typically the bones, because prostate cancer loves, if it's going to spread to somewhere first, it's going to spread to the bones, right? Now, what is the most successful prostate cancer treatment? Now, what they say is, first of all, the best form of treatment is prevention. The best treatment is prevention, Kamal. That is active surveillance. So if you don't have it at all, if you actively surveil it, right, and you're checking your prostate cancer blood tests all the time, then that is one of the best forms of treatment. Yes, sir? You're treating something you ain't got, but you will pick it up at the earliest signs of getting it. That's great. And then surgery to remove your prostate, it's called a radical prostatectomy, has to be done early. It couldn't have spread yet. So if you have a prostate cancer, you don't have a heart problem, you don't have this, it's good to take it out. Yes, sir? Prostate cancer, take it out if it hasn't spread yet. Don't say, well, it's a slow-growing, slow old man disease, let me die with it, and so forth. No, because it could then start to spread. If you've had it for 6-7 years, take it out. You know what I mean? You know what I'm saying? I think that makes sense. People take, man, not bother with that, man. Me here, you could die, you die with it. Are you expecting to die in next 2-3 years? Nah. So then, if you want to really cure your cancer, after the surgery, you should also have radiation therapy, before or after. And this is zapping the thing. So what kills prostate cancer cells naturally? I have to bring this one in. Do you know allium vegetables? What are allium vegetables? Do you know what allium vegetables are, come out? Allium is garlic, onions, right? This group include garlic, onions, leeks, and chives. have been known to help kill prostate cancer. Tomatoes contain lycopene, which slows prostate cancer growth and metastases. Your body absorbs more lycopene when cooked with cooked tomatoes than and those consumed with various oils. You know, now it's important, I believe, that you don't dismiss prostate cancer, that you treat it, especially if the disease has started to spread. And if the disease is widespread, progressing to a biopsy detectable tumor. In other words, the gentleman asked the question, if the person who you are referring to with the prostate cancer has spread to the bones, right? Have they had a biopsy, you know? And that could tell us a little bit about what type of prostate cancer it is, whether it's an aggressive one or whether it is a slow-growing one. You know, a slow-growing one that you've just had for a long time that spread to bones, or whether it was an aggressive one that spread to the bone quickly, you know? And we look at ones that are progressing, account for about 20 to 30% of men. Now, in the absence of early detection or primary treatments, when there's no treatment available, 38 to 50% of these tumors go on to be clinically diagnosed, right? But 10% of them would have spread by the time of clinical diagnosis. And spreading to the bone is clinical diagnosis. But unfortunately, I got to say, I don't want to say, 12 to 25% die of the disease, you know, of the prostate cancer. So how long does it take for the prostate cancer to become aggressive? That's the point. How long does it take for the prostate cancer to become aggressive? There's no single timeline. But aggressive prostate cancer progresses in the body rapidly. We know that. This tendency is in stark contrast to the old man style prostate cancer that tends to move very slowly. I think the person who would written in these questions, some of these questions, say, you're correct. Our former president was diagnosed with stage 4. So this person is from the United States. They was with stage 4 cancer. He never had a test or procedure done early. So he found out late. It, however, spread to all over his body. That's it. So we're talking about President Biden. Now, I'm shocked about that. Our President Biden doing a PSA test, doing a PSA test. Remember I said in a small percentage of prostate cancers, the blood test doesn't pick it up. But it suggests that Biden never had the test in the first place. Biden may not have had the test. I don't know that. I can't believe that the blood test was coming back low all the time. Biden never had the test. That means he never even had a digital rectal examination. You know, Biden was behaving like a black man, right? I'm getting myself in trouble there, right? Come on, I'm getting myself in trouble. Come on, am I getting myself in trouble? The black man free doctor and do what? I know. Way back when, in the 90s, I came down to St. Vincent from, it was 1992. And I used to run some clinics, Kamal. And a whole set of women used to come to the clinic. Young women, old women. In them days, I wasn't a bad-looking guy. And I wasn't sure if they were coming to the clinic because they thought I was a good-looking guy or they thought I was a good doctor. I wasn't sure. But for sure, the men wasn't coming. So you know, the men weren't coming. So it wasn't that the men thought I was a good doctor. They would have come. And then sometime later, the next day, I run a special clinic. I said, only men. I would want men to come. And I did a whole set of rectal examination, took a whole set of blood tests, took the blood tubes back to the United States for testing. You know, I detected 7 prostate cancers, 7, and got all those men treated. But guess what? And the rumors start going around. Thompson love to touch you up, boy. You know what I mean? Thompson love to touch you up. What if Thompson does do things? And people actually thought that I was doing rectal examinations, you know, because I found that to be pleasurable. So the young guys and so forth, none of them came to the clinic. Yeah. I say that because I'm able to speak about that. I say that with all conviction. And the thing is that it's important that we do this. Rasai, you know Rasai? Yes. He had a convenience shop, sell a few different things, food and drinks on the Leeward bus stand. And then later on, he came outside and was in the gap outside. I would see him on the way in the road opposite Gibson, but in a side road to go into. So he wasn't in Tokyo. He was in Leeward bus stand. So he would be along the fence of the Anglican school annex. You know, right? You know the Anglican school. Gibson Hardware, and then the road, and then the Anglican school annex. And that was quite fascinating. So it is certainly appropriate that I bring up the idea of prostate cancer today. That prostate cancer has been changing. Prostate cancer has been becoming aggressive. It is still an old man's disease, because some old men will get a slow growing variety that doesn't spread so quickly. And some men, more and more men, more young men are getting an aggressive, rapidly spreading cancer that is leading to death, you know? And that this is certainly a serious matter, and one that we have to change ideas and looks and everything like that, and an approach. And if this is happening all around the world, not just happening in St. Vincent, right? It's happening in Jamaica, it's happening in Trinidad, it's happening in Australia, it's happening in the United States. And that the important thing is that prostate cancer is definitely affecting Black men. But guess what? President Biden isn't Black. You know what I mean? It affected him too. And so we have to take warning. I went to a Calypso tent, and Sonny Banks was singing a song on prostate cancer. And I wanted Kamal to have played that song, but I don't think he has that recording. So I want to get Sonny Banks. I want to get that little recording. I don't know who will have it, but Kamal, I wonder if I could try and get it for next week. You know? Yes, I'm going to try and see. I know long ago these songs used to be so readily available, right? But the soca music is what readily available, but the calypsos are not. And we will have to take it from there. So, ladies and gentlemen, it's always a pleasure. And I want to wish everybody the very, very best. Men, please take heed. Everybody take heed. I want to bid you a very pleasant good evening and good night.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784